This is part 2 of the presentation I gave on acne pearls, and minocycline 4% foam applied once daily for the treatment of acne vulgaris. This has been newly FDA approved, and certainly there's excellent efficacy and safety data and very good tolerability with this foam formulation, which does not contain alcohol and is very non-irritating. But some important considerations. The pharmacokinetic data show that there's negligible systemic absorption, so the blood levels are very low. But the skin levels are extremely high, actually higher than what you would get with an oral formulation that was studied with minocycline. So you're getting very, very high skin levels and very, very low blood levels that, based on the data that we understand on antimicrobial resistance, may circumvent antimicrobial resistance. Also, it dissolves sebum based on some very interesting studies that have been done. So that's new to the marketplace. Sarecycline, which is an oral tetracycline, narrow spectrum tetracycline based on the microbiologic data compared to other tetracyclines. And if we look at tetracycline associated side effects of interest, the incidence of GI side effects, phototoxicity, and vaginal candidiasis were very, very low with that particular formulation. Now I'm going to move on to oral isotretinoin. And we know about low-dose oral isotretinoin, which has been around, pre-solubilized in fat, that can be given without food, and there's excellent data on that. We actually have 2-year data to show that 82% of the patients 2 years after a standard 5-month course and getting improvement of their severe acne and nodular acne, those patients, 82% did not need any additional treatment, and less than 5% needed to go back on oral isotretinoin or needed to go back on an antibiotic. So these patients did extremely well long-term after stopping the treatment. Now there's a micronized version, which is another advance because you get increased absorption of the drug, 2-fold increase in the serum levels, where 20% reduction of the dose can be given. So that's a new formulation that has recently been approved, where we can give a lower dose without sacrificing the efficacy.